Upon entering the preoperative department, we will have you undress. As a reminder, we ask that you not bring valuables, including jewelry, with you to the hospital. You will be asked to lay on a stretcher and change into a hospital gown. Your nurse will go over your current medications and will ask you other questions that we need verified. At this time, your family is welcome to join you. We will check your vital signs and begin your IV fluids. Patients are given IV antibiotics. These are preventative against infection. The first dose is given just before surgery, while additional doses are given later that evening. The anesthesiologist will come to speak with you prior to surgery to discuss the type of anesthesia you will be given. Most patients will receive spinal anesthesia. Knee and shoulder replacement patients may also receive a regional nerve block. The regional nerve block allows us to only numb the area of your joint replacement. Patients also state they have less side effects, such as feeling nauseated or groggy. You will discuss the details of your anesthesia with your anesthesiologist before entering the operating room. When it is time for your surgery to begin, we will bring your family into the waiting room. They are welcome to remain in the hospital or leave the premises. You will be wheeled into the operating room, and our medical team will begin to prepare for the surgery. Staff will be covering you with blankets, as it is often quite cold in the operating room. The circulating nurse will be available to you should you have any last-minute questions or concerns. Surgery usually takes between 60 to 90 minutes. Once the surgery is completed, our staff will place you in your hospital stretcher. You will then be brought to the post-anesthesia care unit or PACU. The length of your stay in the PACU will be determined by many factors, including the type of procedure and the nature of the anesthetic used. We also want to make sure your pain is under control, and we need to monitor your wound. Generally, patients remain in the PACU for 1 to 2 hours. Family members are welcome to visit and will be notified by our state-of-the-art paging system once you are ready for visitors. Next, you will be brought to your hospital room. All rooms at Connecticut Orthopedic Institute are private. We have many team members ready to care for you. But with so many faces, it can get confusing. Besides wearing our badges and writing our names down on your patient whiteboard, we have also color-coded our uniforms. Staff in the green are the physician assistants. These licensed, thoroughly trained medical providers work closely with your surgeon in the operating room and monitor your care during your entire stay. PAs examine you daily and are in continued communication with your surgeon. Nurses will be seen wearing blue scrubs. Our dedicated team is essential to the care and the recovery of our patients. They have expertise in the post-operative needs of an orthopedic patient. Certified nursing associates will be seen wearing gray tops. These staff members will provide care to you in the hospital, such as vital sign monitoring, bathing, or toileting. You will meet physical and occupational therapists. Physical therapy trains you to be safe while walking or when you transfer in and out of your bed. They will also provide you with strengthening exercises. Occupational therapy retrains you how to manage daily care while maintaining any precautions. Environmental services, who wear a gray top, and our dietary partners in a blue shirt and black pants, are our valued team members who you will see throughout your stay. Our goal is to make your experience exceptional, and we strive to provide a clean environment and tasty meals. Each floor has its own private kitchen, allowing meals to be delivered swiftly and at the appropriate temperature. Once in your hospital room, your nurse will provide you with information on your surroundings and any equipment you may see. Normally, as we walk around, we use our full lung capacity. When we find ourselves laying or sitting for longer periods of time, we tend to do more shallow breathing, and this can lead to pneumonia. An incentive spirometer is a small breathing device that allows you to exercise or use your full lung capacity to prevent pneumonia from occurring. Your nurse will show you how it works. We encourage you to take it home and continue with your exercises for at least 1 week. As stated earlier, you will be given IV antibiotics, and you may see this hanging on your IV pole. Along with that is often a bag of saline fluid. This is to prevent dehydration. Once you begin drinking fluids, we will be able to remove the saline. Patients having total hip replacement or total shoulder surgery should expect to see a waterproof dressing on the joint. Immediately after surgery, we place extra padding to prevent drainage and the introduction of germs into the wound. Total knee replacement patients may be surprised to see not only their knee with a dressing, but rather their whole leg. To help prevent swelling, your surgeon will place an ACE wrap from hip to toes. With all of these dressings, before you return home, the physician assistant will remove the extra padding and leave a much smaller dressing in place. Each surgeon will determine the best dressing for each patient. Most of the time, we use a Mepilex dressing that may remain on for 7 days. You will be provided with instructions on your wound care before you leave the hospital. If you are aware of any allergies to adhesives you may have, please inform your surgeon prior to surgery. While in surgery, your surgeon may decide to place a drain. Drains have a small tube placed near your joint and held in position by a few stitches. The tube then connects to a container that allows our staff to monitor the amount of blood and fluid coming from your wound. If this is required, it is often removed the next day. You will not be discharged home with the drain in place. Ice is very important to an orthopedic patient. It helps to decrease swelling, which then can decrease pain. In the hospital, you will be provided with a special cooling device to ice your joint. When you are home, you will need a gel ice pack or refillable ice pack. It is important to ice your new joint throughout the day. However, you must first place a cloth or dressing against your skin. Never have the cold touching your skin directly. Blood clots are a risk after surgery. When we walk around, the action of our foot hitting the ground and the contraction of our muscles help push blood back up to the heart. By sitting or lying down for long periods of time, it puts us at risk for forming a blood clot. Besides medication and exercises, we have a third way to help prevent the formation of blood clots. During your hospital stay, you will be wearing sequential compression sleeves. A sleeve is placed around each calf. This is connected to a machine that slowly inflates the sleeves with air and gently squeezes your calf or foot, helping the blood to return to your heart. After a few moments, the air will release and the sleeve will deflate. This process will then repeat. When it comes to medication, things can become confusing. In addition to your normal medicine, you will now be receiving new medications specific to your surgery. Your care team will always provide you with the name of each medication you are to be given and an explanation of its purpose. But we encourage you to ask questions. We would never want you to accept medication or a treatment you are not comfortable with. Please call your orthopedic navigator if you have any questions. After surgery, you will need to take a blood thinner. Your surgeon will select your blood thinner based on your needs. There are many different types of blood thinners, and most are in pill form, but they can also be given by injection. It is important to be aware of any possible out-of-pocket costs. Also, please review the guidebook for side effects. Our staff wants to make sure you are as comfortable as possible. One way is to keep your pain under control. We use this pain chart so that you can help guide us to how much medication is required and its effectiveness. A rating of 0 tells that you have no pain, while a rating of 10 will let us know you are in extreme pain. Our goal is to control your pain so that you are comfortable and able to participate in physical therapy and daily activities. There are different options we can provide for pain control. Our goal is to use less narcotics while still keeping you comfortable. You will be given a regional block in surgery that can last 1 to 2 days. Your surgeon will order you medicine in pill form that will begin to work roughly 30 minutes after taken. It is important that you are honest with your care team about your level of pain. We have already spoken on a few ways we try to prevent infection, including staph testing, chlorhexidine showers, wearing clean clothes daily, and using clean towels. But the most important tool is hand washing. Whether in the hospital or home, it is imperative that you and your family maintain good hand washing. To wash your hands properly, you should be wetting your hands and applying soap. Rub your hands well. Remember to get between your fingers and under nails. While washing, you should sing Happy Birthday twice to make sure you are doing this for the correct length of time. Purell hand sanitizer is provided throughout the hospital. All medical and non-medical staff should be using the Purell before entering your hospital room. Earlier in the video, we discussed getting your nares swabbed so that we could test for staph. One type is methicillin-resistant Staphylococcus aureus, or MRSA. You will be given an IV antibiotic specifically for this type of staph. Our staff will be required to wear gloves and gowns when entering your room. You will be considered MRSA positive until you have 2 negative tests. This is all done as an abundance of precaution. We have a lot to accomplish in the short time you are with us at the Connecticut Orthopedic Institute. You will have multiple therapy sessions. You have nurses and aides continually in your room for medication and providing personal care. Doctors and physician assistants will be assessing your medical well-being. Members of the phlebotomy team will need to draw blood. And you need to eat. Furthermore, sleep is a critical component to the healing process. We do our best to give you time to rest, but there are necessary check-ins. It is important to try to nap throughout the day whenever you get the opportunity. Our #1 priority is your safety. Patients are often surprised by how quickly they are able to get up and walk around. Unfortunately, this can lead to patients forgetting to call for assistance. While you are with us, we ask that you always call for a staff member before you get out of bed. If we assist you into the bathroom, please do not attempt to get back to your bed or chair by yourself. Physical therapy is an absolute necessity for orthopedic patients. Getting up and walking helps prevent blood clots, pressure sores, pneumonia, and the formation of scar tissue. The Institute has its own gym, which includes required durable medical equipment, a staircase, and car setup to prepare you for discharge home. The therapists work with you multiple times during the day, both individually and alongside other patients. Our joint camp allows you to visit with other patients and to help encourage each other to get back to the activities you love. Our nurses and aides are trained to assist you to walk throughout the floors even after your therapy sessions. It is important to change positions throughout the day to avoid scar tissue. A buildup of scar tissue can cause your joint to remain contracted, causing a limp. And we strongly encourage you to eat all your meals while sitting up in your hospital room chairs rather than in bed. Eating upright is better for your digestion, and we want to promote your activities of daily living. Our goal is to get you home safely, to make sure you can be independent at home. You need to be able to get in and out of bed, to walk with a rolling walker or cane, and to be able to go up and down stairs. You will be provided with low-impact exercises to practice. We will alert to any precautions or movements you should not do. You will then need to practice moving about while maintaining those precautions. Finally, we need to see that you can safely use the toilet. Patients having posterior total hip replacement will have precautions for 3 to 6 weeks. These precautions are taught so that you do not dislocate your new hip joint. You should never cross your legs. Do not bend over beyond 90 degrees. This can be tricky going from a sitting to standing position. Our therapist will teach you the best way to do this. Do not rotate feet excessively inward or outward. Do not twist at the waist. For total knee replacements, when crossing your legs, it can put a lot of stress on the outside and inside of your knee. From your hip to your ankle is a no-pillow zone. Extension, or how straight your leg is very important. If you don't get full extension, meaning 0 degrees, you will walk with a limp. A pillow underneath your knee can cause the muscle to tighten and cause a contraction. Instead, place a pillow underneath your ankle. This will help gravity push your knee straight. Total shoulder replacement patients should only bear weight on the operative arm if told to do so by your surgeon. Your arm will be placed into a sling or shoulder immobilizer, and you should not attempt to rotate your arm outwards or towards your back.